Even if she was, at a 5-year-old level that talks a lot, that's great. I'll take that forever. So we'll take any level as long as she can communicate. Because right now she can't tell us what hurts or what she needs or, how things feel.
In a world filled with uncertainty and risk, we want to do everything we can to protect our children. In that respect, Lori Hops is no different than any other mom. But Lori's hopes and dreams for her 8-year-old daughter, Brianna, are different from those of most parents.
I just want her to be able to, tell us what she needs or wants. Because I know, she'll live with me forever, of course. I'll always take care of her. But I just want her to be able to talk. That's my main goal for her. Pretty much just my only goal. Just as long as she can talk. Everything else is okay.
Brianna, or Weeble as family and friends know her, is full of curiosity and mischievous energy. But her life has also been filled with challenges.
She's having seizures, by the way, right now. So you're fixing to see a bunch of these. These are the head drops I was telling you about. We've got to get some kind of control, better control on them than what we have.
Brianna was born a beautiful, healthy baby girl in Central Florida in 2002. But just before her first birthday, she became sick.
She had a fever, and she had a runny nose, and then she started the vomiting, and she just slept a lot. She was real tired, so it did just look like a cold, the flu or something. And then it wasn't till she wouldn't wake up, and she couldn't hold her head up, and she wouldn't sit up. That's when we knew something was wrong. But by then it was too late. They did 2 spinal taps, and then they had to do the 3rd one in Orlando. They took her up there emergency, and they found out it was meningitis.
Weeble had contracted strep B pneumococcal meningitis, a disease that causes inflammation of the membranes that protect the spinal cord and brain. It's a disease that kills roughly 20% of its victims. Weeble suffered a stroke, which left her brain damaged.
She was having seizures literally non-stop. They had to put her in a medically induced coma because she was just seizing and seizing over and over again. They said she wouldn't make it through the night. She wasn't going to make it through the night. And the guy said it 7 times. We don't think she's going to make it through the night. I don't think I really thought she would make it, so our great-grandma was planning her funeral, but I wasn't. I didn't really think they were serious. It was on my birthday, the 23rd of May, is when she kind of you could tell she was getting better. Everything started, her levels started going normal. So that's when I knew she'd be okay. They told me how what it had done to her spine and her right side weakness from the stroke, but they didn't really explain when they sent her home with me what it was going to be like. So it was kind of like being sent home with a newborn. She's now has the mind of a 2-3-year-old, and it's slowly, and she's been about a 2-year-old since that day. So in 8 years, it hasn't really changed much. So she's forever, a baby, pretty much.
Lori, Weeble, and their family and friends deal with every challenge and have hopes for a better future. But for Lori, there is a heartache in knowing that a vaccine could have prevented the pneumococcal meningitis that changed her daughter's life.
I was for vaccines. I didn't know what vaccines, whatever they said she needed, I was, willing for her to have. My doctor did not tell us about the pneumococcal meningitis vaccine.
The pneumococcal vaccine is just one of the vaccines that have been developed in the past couple of decades that have helped keep infants and young children safe from disease.
What's extraordinary now is if I'm at home and I get a call from a family and it's midnight and the child has fever and parents are worried, my first question is, has your child been vaccinated? And if they've had their vaccines already, I can say, you know what, this is a virus. I'll see you in the morning. If it's not better, we can take care of it, but it's not a big deal. Just 15 years ago, I would have had to say, there's a chance that this is meningitis. There's a chance that this is bacterial sepsis. You need to go to the emergency room now. We need to draw blood. We need to check your urine. We need to do a spinal tap. It's extraordinary to imagine that because of those 2 vaccines, families don't need to worry about fever the way they once did.
Before vaccines, many children died from diseases that vaccines now prevent, such as whooping cough, measles, and polio. Those same germs exist today, but vaccines now protect babies, so we do not see these diseases as often. In fact, all common childhood diseases have been dramatically reduced by immunization. This chart shows the dramatic impact that pediatric immunization has had on the number of reported cases of some of the most common childhood diseases. diseases like measles, diphtheria, mumps, and pertussis.
I grew up in the 50s and 60s and got measles and mumps and chickenpox and German measles. So for me, again, it was very easy to vaccinate my children. But, young parents today not only don't see these diseases because vaccines have been so effective, they didn't even grow up with these diseases. So for them, vaccination becomes a matter of faith.
We as parents, basically, we have to get our children ready for their lives and their future, for them to be happy, to be healthy, to contribute to society. Vaccines are part of that.
To help parents and providers keep track of the immunizations that help prevent harmful diseases, the Centers for Disease Control and Prevention publishes a recommended schedule available online or by request. The Early Childhood Immunization Schedule specifies which vaccines are required and exactly when they should occur during a child's development from birth to age 6. You can find the immunization schedule online at www.cdc.gov/vaccines.
You can click on the link for schedules and access the schedules at that site. The schedules will give you the recommended age for every dose of the routinely recommended vaccines. Be sure to, when you download the schedule, download the footnotes, because there are many important points that you just can't display on the schedule and keep it simple. So they're in the footnotes. So it's very important that you have the footnotes as well.
The first shot a baby receives occurs just after birth. This is for hepatitis B, a viral infection that can cause jaundice or even worse, liver cancer later in life. Worldwide, hepatitis B causes 80% of all liver cancer. Some parents are concerned about their children receiving a shot so soon after birth, but there is a good reason the hepatitis B vaccine is administered so early.
Hepatitis B virus is transmitted. It's a blood-borne disease. It can be sexually transmitted, but it can also be passed from a pregnant mom to her fetus.
If you catch hepatitis B at or around birth, you have a 90% chance of going on to develop chronic or long-term hepatitis B, which is to say cirrhosis or liver cancer.
We know that the hepatitis B vaccine works to prevent perinatal infection when given at birth, after the baby's born. That birth dose is critical for preventing it.
The second round of immunizations occurs in the pediatrician's office at 2 months of age. They include a second dose of hepatitis B vaccine, a shot to protect against polio, and a shot to protect against Haemophilus influenza, or Hib, a dangerous form of meningitis.
There are cases where I've taken care of kids who have ended up deaf and mentally retarded because of Haemophilus influenza, which it's a shot. It's a shot that could have prevented the deafness, the mental retardation.
At 2 months of age, infants also receive a combination shot, often called DTaP, that protects against diphtheria, a bacterial infection, tetanus, a type of paralysis you can get from a wound infection, and pertussis, which is sometimes known as whooping cough.
For younger children, pertussis is a deadly disease. They literally cannot breathe. They turn blue, and despite all that we do with medications, with ventilators, etc., we very often lose them. I lost one of those children when I was a resident. The pertussis that baby got was brought home from his father.
When Ellie first started coughing, I knew that it wasn't just a normal cough.
Rodney Throgmorton lost his daughter Haley to whooping cough in 2003 when she was just 6 weeks old. Haley contracted pertussis from her dad, who had contracted it from Haley's grandmother.
Haley passed away when she was right at a month and a half old, and she wouldn't have received her first round of DTaP until she was 2 months old.
To protect Haley, Rodney and the other adults and adolescents in his family needed a pertussis booster. A pertussis booster that was developed too late to save Haley.
There were not any pertussis boosters for adults back then. And so I would have been 4 years old when I got my last shot. I didn't realize it as an adult, but my immunity had waned by the time I was 12 for sure.
Since the time of Haley's death, a pertussis booster for adolescents and adults has been developed.
We call it Tdap because it's also combined with the tetanus and diphtheria components.
In January of 2011, the CDC expanded its Tdap recommendations. Adolescents 11 to 18 years of age, preferably at age 11 to 12 years, and adults 19 through 64 years of age should receive a single dose of Tdap. For adults 65 and older who have close contact with an infant and have not previously received Tdap, one dose should be received. Tdap should also be given to 7 to 10-year-olds who are not fully immunized against pertussis. Of course, once an infant is 2 months old, the best protection against pertussis is the DTaP shot, a shot Rodney Throgmorton wishes his daughter had been old enough to receive.
I would tell other fathers, it's your job to protect your children, and you don't like to watch a doctor stick a needle in your child, but you sure don't want to watch a doctor put your child on a respirator.
Staying on course with the CDC recommended immunization schedule can ensure a healthy childhood.
I think this schedule is very appropriate. And of course, it's prepared by the Royal Smart people. It's not prepared by trench doctors like me. It's based on years of research and efforts to make sure that it's really the best thing to do for the children.
When you make up a schedule, not only do you increase the period of time during which you're susceptible to vaccine-preventable diseases, but it's confusing, and sometimes kids miss doses.
If a vaccine dose is missed, or if parents get a late start on vaccination, the CDC does have a catch-up immunization scheduler for children age 6 and under.
So when it comes to a series of vaccine doses with one particular vaccine, if someone happens to miss a dose in that series, if the interval between doses is extended, it is not necessary to restart a series. You just pick up where you left off and continue with the series.
Despite their best efforts, some parents and providers have a tough time keeping track of shot schedules and records.
Frankly, the current immunization schedule is complicated. I mean, we now are up to giving vaccines to prevent 14 different diseases in the first few years of life.
That's where Florida Shots, our state's online immunization registry, comes in. Florida Shots helps parents, healthcare providers, and schools safeguard immunization records in a free, statewide, centralized online registry.
What a vaccine registry allows families to do and pediatric practitioners to do is to know which children have had their vaccines when.
Florida Shots also provides simplified shot record verification when it's time for kids to go to school. Starting in pre-kindergarten, all children who attend public and private schools in Florida must meet the immunization requirements mandated by the Department of Health. These requirements help protect children from potentially harmful vaccine-preventable diseases.
Children who are starting kindergarten are required to have 2 MMRs, 2 varicellas, 3 hepatitis B vaccines, and 4 polios and 5 DTaPs.
Florida Shots helps ensure that shot records are up to date and reduces registration hassles for schools and parents.
Students who aren't in compliance with their immunizations are not allowed to attend school. My Florida Shots gives the school staff the ability to pull them up, thus limiting parents running around trying to get the immunization status, and then the schools can enroll the child.
While Florida Shots can help parents, schools, and providers keep track of shots, many families need help paying for vaccinations. The Florida Vaccines for Children program helps ease the financial burden for parents.
Anybody under 18 can qualify for vaccines for children if they have no other source, primarily through private health insurance, to get that. They can get those vaccines for free without any cost to the parent through the Department of Health or through their healthcare provider. Their pediatrician, their family practitioner, their nurse practitioner will have vaccines with the Vaccines for Children program, and they can get that at no cost to them.
Together, Florida Shots and Florida Vaccines for Children ensure that babies and young children receive their shots when they need them most.
Pediatrics, prevention's the name of the game. We know that whether you're talking pool safety or booster seats or immunizations. It's far better to prevent a disease or a disaster than to try to repair it.